Donation Programme is the development of public-private partnerships. The effort could not have been as successful without teams of all types. Indeed, MSD made the decision at the beginning that MDP should foster close ties with all sectors.
It was a combination of a company contributing the drug and then foundations and governments and private groups getting together and figuring out how to do it.
The partnerships include ministries of health, international agencies, NGOs, and of course MSD and MDP. It's an extraordinary mix, but when all parties are working towards the same objective, differences melt away.
Your crops, your grains, and
on the ground level, NGOs coordinate with each other and the ministries of health to oversee distribution and work with the communities. The ministries and NGOs partner with MDP to collate information and handle logistics. And MDP works with MSD on drug production requirements and distribution. The programme prides itself on the high level of collaboration, which is not lost on the partners themselves.
The NGOs, the governments, the other WHO organisations and international organisations all have a voice within that partnership.
And another quite extraordinary partnership was formed, one that would surprise many people and significantly expand the programme. It was discovered that Mectizan, when taken with another drug, albendazole, can help prevent lymphatic filariasis. LF, which is also known as elephantiasis, is a horribly disfiguring condition that causes severe swelling of the limbs and genitals. Echoing the success of the Mectizan donation programme, GlaxoSmithKline made the decision to donate albendazole for LF and to partner with MSD. In 1998, MSD made the decision to expand the Mectizan donation programme to include LF in Africa, where it exists alongside river blindness. In those co-endemic countries, both drugs would be given together.
The Mectizan donation program actually looks at both those drugs, and that is, everything is coordinated through one department. But this partnership between GSK and Merck, I think, is unique, and most people have no idea how closely we actually cooperate together.
Adding lymphatic filariasis was a transformational moment for the Mectizan donation program. It set the bar still higher for an initiative which had already broken through several barriers. Now, two companies were working together, and two scourges were being targeted together. Charles Mackenzie was closely involved in the programme at the time of the announcement.
I think there was a true belief that this was something that could be achieved, and that it would be achieved better together. And when it started, how did it look?
Lymphatic filariasis is a terrible disease that is often misunderstood, even by the people who have it.
Itching to begin, and
it's transmitted to humans by mosquitoes, which inject parasitic worms that grow into adults.
The adult worm that's lying in the lymphatic vessels causes a dysfunction to those lymphatic vessels, actually by causing the vessels to enlarge and become ineffective because they're too large. Not actually blocked, as many people think. The changes that occur in the skin then occur because you're not getting effective drainage of lymph away from that limb.
The result is severe swelling to legs and arms, and also men's genitals. Lesser known effects are acute feverish attacks that can last for days. Psychologically, those stricken often cannot find work or form relationships. Many suffer from depression. Estimates put the number of people infected at more than 120 million, 44 million with symptoms. Lymphatic filariasis spans Africa, with 1/3 of the billion people at risk living on the continent. Here in Freetown, Sierra Leone's overcrowded, under-resourced capital city, a public campaign is being launched.
They provide the means.
The dual objective is to educate people about LF and give Mectizan and albendazole to 1 million people in just 5 days. Such an ambitious plan hasn't been attempted before in an urban setting like this. Many of the city's inhabitants fled here during the country's brutal civil war, quadrupling the population in a confined space squeezed between mountain and sea. Large numbers live cheek by jowl in squalid makeshift slums.
Today is a result of many years of hard work.
Mary Hodges, the country director of Helen Keller International, is leading the distribution campaign here in close coordination with the government and USAID. For the launch event, LF patients have been assembled to take the first doses of the campaign, which has been heavily promoted in the media. One person who heard about the campaign is Fatmata. The 25-year-old is distraught because for years she's lived with terrible disfigurement without knowing the cause. When she heard the announcement on the radio, it struck a chord and she made her way to the event. The emotion of the moment is almost too much. LF has quite literally ruined Fatmata's life. She had to drop out of school, can't find work, and is embarrassed and ashamed by her condition.
Today I hear about this. I only lost friendship, no friend. Everybody know me just because of the problem. Nobody want to see me. I can't go to a place where people are gathered. They're all looking at me. Some people are mocking at me just of the problem.
Yeah, you're helping us with community sensitization.
Mary counsels Fatmata about the disease and what can and can't be done in her case.
Mectizan and the albendazole will bring this under control.
It illustrates one of the greatest challenges for the campaign. Like many other victims, Fatmata had been to doctors and natural healers who didn't know what it was and prescribed treatment that was useless. Mashaka is another LF sufferer. He lives in the slums of Dar es Salaam, Tanzania. He's moving fairly well, his altered trousers attempting to conceal the disfigurement beneath. But when he's in his cramped room, there's no hiding. Mashaka has stage 4 lymphatic filariasis. He's been receiving treatment since 2007, which has helped with the acute attacks, but it wasn't possible to reduce the swelling. Now 28 years old, he should be a professional football player in his prime. Mashaka tells us that when he was younger, he was an excellent player. He'd made it to the second highest league in Tanzania, but then the disease struck and his dream was gone. When the disease is caught earlier, there's more that can be done. In rural Tanzania, there's a group of LF patients who've been visited, monitored and treated by a Ministry of Health team and Charles Mackenzie for years. Hidja, a carpenter, is one of them. He used to have grade 3 LF with a badly swollen leg and a foot that was numb, which made it difficult to work. Having been in the program since 2001, not just taking the medication but also being educated in careful washing of his limbs and good hygiene, he now has feeling in his foot and he can easily bend his leg. Hidja is now married, earning a living and contributing to the community. According to Mackenzie, he's got a new lease on life.
The psychological aspect of this disease, which is very depressing for those that have it, and they were always, when we saw patients in the beginning, they were not people who were really happy. And now we find people are happy and they're very much in gratitude for what the program has brought.
Miriam is another member of the group. Like Hijja, her symptoms used to be considerably worse, with severe swelling and frequent acute attacks. Her husband moved out, taking their 2 children with him. Now, having been in the programme for more than 10 years, Miriam is literally back on her feet. She runs a small restaurant out of the front room of her home, cooking the food herself. Her acute attacks occur only once every 2 to 3 years, and she's in a much better place, both physically and mentally. If they hadn't joined the LF programme, which places great emphasis on good hygiene, Miriam, Hijja and others may have continued to suffer in silence.
In the field, she really needs to put these creams.
Mackenzie says their progress is gratifying on many levels.
It's an extraordinary feeling. It's something, as you say, a scientist who works at the bench, and yes, I've worked in the field a lot, but the science seems to be really worth it when you see people improving. And to be part of the team here, to have put that together, is one of the most satisfying things in my professional career.
So the campaign covers much more than drug distribution. The key is to raise awareness about the disease's cause and effects, that taking appropriate medications can help prevent transmission.
You can reduce the level of infection within that community to such a low level that the mosquito can no longer effectively transmit new disease to new people. So you're not curing those who have already been infected. They will still have their swollen limbs and they still need care. But you can break the transmission and stop new people from becoming infected.
That's the message on the streets of Freetown. And in the slums, in the homes, going door to door when necessary, and in areas outside the city.
It's been a tremendous success. People have been turning out everywhere you look. There's people walking around the streets with dose poles. We've been stopping ad hoc anywhere, like in this community. We just stopped because it was a far distance from one health centre in that direction and one health centre in that direction. So we just pulled the car over to ask, have you had your pills? And 80% of the eligible people in this community have said yes, they had their pills.
MSD's pledge and visionary idea to donate all the Mectizan that is needed for as long as it takes to defeat river blindness has had a tremendous impact. Now, thanks to the work of the partners who've been committed for decades, younger generations are able to work, play and enjoy life without the spectre of river blindness or lymphatic filariasis. They can be more productive, provide for their families and live happier lives. They can apply the lessons learned to other health campaigns, leaving a lasting legacy of a programme that has combined broad, innovative thinking with local knowledge, courage and determination.
I would say that for all of us back here, we should take a great life's lesson from this collection of humane, rational, enlightened people who are so committed, so dedicated that they are out there day after day facing all kinds of personal hardships and dangers to ensure that this medicine can be delivered to the people who need it.
Especially nowadays in which we are confronted with diseases that are emerging again, and be able to eliminate one disease is to prove that it was possible.
Something I like to say is that this program is the patients. It's not just the drug distribution. The reason this program was put together, the LF program and the ONCA program, was the patients.
Here we are 25 years later, and what was interesting, the maximum we thought in Africa at the time, people at risk, was around 45 million. We're now up to over 100 million in Africa, and they're still donating. It's a remarkable achievement, I think.
And what's happened now, as we're seeing the control of the disease, leading to elimination is large areas of Africa are being farmed again. People are able to farm well and with the knowledge that, okay, they may be being bitten, but the biting is not going to lead to the manifestations of blindness.
I think those people who are doing this work out there in the villages, out there in the bushes, so to speak, they are really the heroes of the Mectizan story.